Let's see. We'll now move to our third presenter. Dr. Karen Fingerman is a professor of human development and family sciences at UT Austin. She studies adult development and aging and is the founding director of the Texas Aging and Longevity Center. She also oversees the graduate portfolio in aging and health at UT Austin. Her research has asked how relationships with family members, friends, and acquaintances change from young adulthood to old age, with particular attention to emotional qualities of ties and support exchanges. Dr. Fingerman directed the Family Exchanges Study, a longitudinal study involving middle-aged adults, their romantic partners, grown children, and aging parents, multiple generations. This project has shown the ways in which midlife adults negotiate demands and connections with generations above and below, as well as considering the implications of family ties for young adults and older adults. Dr. Fingerman is currently conducting the NIA-funded Daily Experiences and Well-Being in Later Life study, looking at over 300 older adults' social relationships and physical and cognitive functioning in a daily context using a variety of sensory and ecologically valid assessments. Similar to Dr. Fouth, I have crossed paths with Dr. Fingerman throughout the last several years. I have admired her work and happy that we can hear from her now. Welcome, Dr. Fingerman.
Thank you. Thank you so much for having me. And I do want to say that those talks were just amazing, Beth and Jeremy. Next time I'm going to ask to go first so I don't have to follow you, because those were just great. And I am pleased to have the opportunity to be here with you and present some. And I may refer back to Dr. Jorgensen's talk as I go through. I'm going to be talking about family and the technical milieu, TV viewing in late life. Interestingly, we talk a lot about screen time for children, particularly during this pandemic, where it's been a saving element for many families. But there's also screen time in late life, and television is the main screen time in late life. Still, television, we think of it as old-fashioned and out of date, but for people over 65, it is still very much a part of their lives. And on average, they watch 7 hours of television a day. So it's really very pervasive and very important. And yet we know very little about the role that it plays, particularly with regard to family, because that seems like those two things would go together. Interestingly, I'm going to talk a little bit about couples in a minute. And as Dr. Jorgensen pointed out in his talk, they do spend their leisure time together often. TV is associated with a couple of things that are well, first of all, it's associated with sedentary behavior. So it is the opposite of sort of Dr. Jorgensen's information about exercise. I'm looking a little bit at what's going on when you're really lazy and that TV is on. The other thing that it is associated with is loneliness. And here it's complicated. It's not clear whether people watch television because they are lonely or they get lonely watching television, or even if those two things go together. And so that's an interesting question. We know that when people in a study where they just ask you, how much have you watched TV this year? And you say, a lot. And how lonely are you? I'm very lonely. Those two things go together, but do they actually occur together?
Karen, your screen, I don't think you're sharing your screen.
Oh, gosh, let me try again. I thought I had. Okay,
there
sorry.
We go. There we go. Perfect.
Okay, no, let me catch you all up then. Okay, so they watch 7.5 hours TV and sedentary behavior. So here we go. We're going the fast way through these. This loneliness thing. Are they lonely? How do those two ideas fit together? And then what happens throughout the day? How does TV fit into family life? So again, like Dr. Jorgensen, I'm very interested in life as it's lived on a daily basis. And in this study, that's what we wanted to know, was how do these two things fit together? Now, one possibility is that people watch TV alone, and they do it for companionship. This may also be the case that people who live alone watch more TV, and the people who live alone in late life are going to be more likely to be those who are widowed or perhaps divorced. When people have a spouse, they are likely to watch that TV with a spouse for a variety of reasons, including, as Dr. Jorgensen pointed out, they often live in the same household. It's a patterned activity. They're comfortable doing something that you do, every day at 10, we watch this game show or whatever it is. And you're comfortable being sedentary with your closest ties, particularly those you live with. With less close ties, it requires movement. They introduce you to new situations. They make you do diverse behaviors. And even if you have them over to your house, it requires that you get up out of your chair. Being sedentary is one of the biggest problems in late life, and it is a known risk for mortality. So just getting you up and about is what happens with less close ties. But we predicted that spouses and close ties would have you watching TV a lot more. We did this study, as Dr. Jorgensen mentioned, the Daily Experiences and Wellbeing Study. We did it in the greater Austin area, which actually is quite a large area. We have rural, suburb, urban. We have a very large mix of different microcosm of the country almost. We did a 2-hour initial interview for 333 of these people. Afterwards, we put a number of devices on them for 5 to 6 days. And I'm going to go through each of these devices with you. But basically, we were tracking a number of different activities in their daily life as it occurred. And we have a slightly lower number here because I could give you a whole lecture on technology failures. If you put multiple devices on people, they're going to fail in different proportions. So the number we actually got everything on was 313. These were primarily aged older. They were all at least age 65. We had a nice range. We also had a nice range on health, although they were generally healthy because they lived in the community. They were more educated than the general population, but Austin is a very educated population. So half of our population over age 65 has a college education, as did our sample. And about 60% of them were married and 40% of them weren't. And I'm going to be looking at whether they lived alone or not, which is really more or less the same thing in this study. Okay, so I told you I would talk about each of the devices. We had something called an electronically activated recorder. And what that is we gave everybody a handheld device. We used an Android for a variety of reasons having to do with programming. And that way everyone had the same device and we could, train them on it and so on, because a lot of these people had never dealt with this kind of a smartphone-like device. On it, there was an app that recorded 30 seconds out of every 7 minutes of sound in the environment. And we generated 158,000 sound files, 80% of which had sound, because, sometimes there's silence. And so we coded those for television viewing. The coders were 99-point-something% agreement. We had 2 people code each sound file. And that was only because someone wasn't paying attention when they disagreed. It was very rare, and that got easily resolved. We took those and turned it into codes in the past 3 hours, was the television playing in the last 3 hours. And you'll see in a minute why we did that. I just wanted to show you, this is the sound waves from 9 a.m. to 9 p.m. of our average participant. And the brown is television viewing. And the rainbow is conversation. So you can see that there is a lot of television viewing compared to actual human conversation and interaction. We did also what are called ecological momentary assessments. They're EMA. They sound really fancy. And basically, it's just a self-report every 3 hours. So that little device would pop up a set of questions every 3 hours, which is why we looked at television viewing every 3 hours, because our other information was at every 3 hours. What have you been doing? Who have you been with? And we had a lot of information. In the baseline interview, we had something called the Convoy measure, and we transferred all the information from that onto the handheld device. So we knew who they encountered. They could also report on people who weren't those 10. But for those 10, we know every time it was the spouse or the child or the friends. And then if they reported someone who wasn't in that Convoy measurement, they could still say, oh, yes, it's my friend or my acquaintance. So every 3 hours, they gave us that information: friend, acquaintance, extended family, and who else they had been with. I just want to point this out because later when I analyze the data, show you the analyses, this is how we grouped it. Were they alone? Were they with a spouse? Were they with other family? Were they with friends? And were they with others like strangers, acquaintances, your doctor, your neighbors even might be listed there? We asked whether it was in person, by phone, or by text. And again, that's every 3 hours. Now, when we look at who's alone, they're going to be alone in person. So you could be watching television and, talking on the phone, or you're sitting there texting, particularly if you have teenagers. That's pretty much the way it goes. Not so many of our old people were doing that, but we did know if they were. Now, this device is called an Actical, and you wear it on your wrist. It looks a lot like a watch or a Fitbit, but it's really fancy version of that. It has multiple what are called accelerometers, which is what is in your Fitbit, but there's many of them, so they can actually get a very precise measurement. And from that, we looked at the proportion of time that they were sedentary in the past 3 hours. And then we looked at their total activity count. And again, that's a very precise measurement. It measures every minute, and we could look at how active they were and how sedentary they are. They're not opposites, because if you think about it, like I'm sitting here right now, and I might, be sitting here for 90 minutes, but then maybe I'll go out for a run for a half hour. So I was very active, and my total activity will look high, but I also spent a lot of it sedentary. So you can look and see how those go together. Well, when we looked at the television viewing, our participants spent about 6.4 hours on average. That was 37% of their waking hours. We coded television. It's a lot. It's not as high as that 7 hours on average that I was talking about at the beginning, but it's a lot of their waking time. We did something called a multi-level model, which accounts for the fact that people have a lot of different responses. And so we're just kind of finding a way to make sure that someone who answered 50 surveys doesn't pull our findings compared to someone who only did 10, because not everyone did the same number of surveys. People skip them and things. But regardless, that finding is there, that when they are alone, they're much more likely to watch TV. So that was there. You might have thought, well, of course, but it hadn't ever been observed. And a lot of things we expect, we don't find. Interestingly, they do watch it more with their spouse, and they are less likely to watch with other family, friends, or acquaintances. This intergenerational are their grown kids, and it's probably the fact that their grown kids sometimes come over and they just sit on the couch, whereas maybe they're more likely to get out and about with these other people. So it's less likely here and more likely with the spouse or alone. Okay, I won't show you these findings. I'm just going to tell you, and I think that they're really, I can show you them another time with all the models, but basically when people are watching TV, they are more lonely. They are more sedentary, and they are less active on average. Most people, this is what it looks like. When you look at it by residential status, do they live alone? Well, as we said before, once you look at this with living alone included, television viewing makes you more lonely, but it gets complicated on living alone. It makes you, living alone, this is what's called an interaction effect. I'm going to show you this, but it makes you less active, but the patterns are complex. And what you find here for loneliness is that if you live alone, television viewing, a greater proportion of television viewing is associated with greater reports of loneliness. Not living alone, basically you live with a spouse, maybe a grown child, maybe both. TV viewing has no association with your loneliness. It's only for those who live alone. It suggests that maybe they're trying to turn on the television because they feel alone, and it's not helping. It's just not helping. And their loneliness is just even maybe feeling worse because they can't get rid of it. Now, the activity is more complicated. So what happens with activity here is that if you live alone, you're less active the more TV. Oh, wait, I'm sorry. If you live with someone else, so this is the people with their spouse, probably, or their grown child. They are the ones who are more likely to be sedentary, less active, more television. There's not as strong an effect when you live alone. Why is that? Why is it that if you live alone and you have the TV on, you're not showing any effect on your activity? Well, it could be, I call this the CNN at the airport effect. It could be that when you live alone, you just have the TV on in the background and you're running around, getting to your gate or doing whatever. But if you live with a spouse, you turn on the TV and the two of you kind of sit there because it's a way of feeling like a couple, but not having to be actively engaged or in each other's presence. It's a passive, it can be relaxing. TV is not only a, you know, a source of loneliness and such. In summary, TV is still the screen of choice in late life, as we see more and more research on the internet, and we see more and more older adults need to use the internet. We need to train them in things. We need to recognize they already have a screen they like a whole lot, and it's a part of their lives, and we probably need to consider that. The associations observed sort of in those big studies of, yes, I'm lonely, yes, I watch a lot of TV, they are occurring when you observe it in the moment. It's not just that people are, a constellation of people do both. It's that when you watch TV, you feel more lonely. When you watch TV, you're less active. But there are different effects on living alone. And so again, if we were thinking about who should, shouldn't, what it means to watch TV, it depends. Are you married? Are you, you know, doing some of the things that Dr. Jorgensen was talking about, or are you widowed or alone in some way? And so I guess I would say we need more research on television, and we need more research on understanding people who are alone in late life, and perhaps more so during the pandemic, because people who are alone a lot more. I do want to acknowledge the funding that I've had for this and the support I've had. And I also, I should have mentioned at the start that I have doctoral students and collaborators who helped with this study, and I'm very grateful to them. And I want to thank you for your time. And especially I want to thank Dr. Jorgensen for including me in this.
Thank you so much, Karen. That was wonderful. I'll clap
Thanks.
for you. Everybody else is clapping in front of their computer screens for you as well. Wonderful. So applicable to so many lives. And thank you both again so much. We'll see you all later. We'll go ahead and sign off now.
Thank you.
Thank you. Thank you so much.